Antibiotics are incredible tools for fighting off infections, but even commonly used medications can sometimes have unexpected side effects. One widespread antibiotic, doxycycline, while incredibly useful, comes with a particular concern for some individuals: photosensitivity. Photosensitivity makes your skin much more sensitive to sunlight, which can lead to rashes and other uncomfortable reactions. Let's dive into doxycycline, its uses, the different kinds of rashes it can cause, how to prevent those rashes, and what to do if you experience one.
Doxycycline is a member of the tetracycline antibiotic family. It's a versatile tool used to fight bacterial infections ranging from Lyme disease to stubborn acne. It's even sometimes used as a preventive measure for travelers going to areas where malaria is a risk.
One significant side effect of doxycycline is photosensitivity. This means your skin becomes significantly more sensitive to the sun and can react negatively even after short periods of exposure. Studies show that 3 to 6 of people on doxycycline experience this kind of reaction, making it something to be aware of if you are prescribed this medication.
There are two main kinds of doxycycline rashes you need to know about. The first is a true allergic reaction to the medication. These rashes often appear early on during your course of treatment. Your doctor will likely advise you to stop taking the medication and switch to an alternative. The second type of rash is directly caused by sunlight exposure. It can mimic the look of severe sunburn, complete with itching, redness, and sometimes even blistering. While less dangerous than a true allergic reaction, this photosensitivity rash can be incredibly uncomfortable, and
If you develop a rash while on doxycycline, the first step is determining if it's truly an allergic reaction. An allergy rash can look like hives, scattered red dots, or widespread welts. It often shows up within a couple of days of starting the medication, although it could surface any time during treatment.
Stop taking doxycycline immediately and contact your doctor. They'll probably switch your medication and may recommend ways to manage the rash symptoms. Over-the-counter antihistamines, anti-inflammatory medications, and soothing lotions can help minimize the itch and discomfort while your body fights off the allergic reaction.
If you're on doxycycline, the best way to deal with a photosensitivity rash is to not get one in the first place. The key here is sun protection. Minimize exposure. Stay indoors when possible, especially during the most intense sunlight hours. 10 to 3 protective clothing. If you must go out, wear wide-brimmed hats, sunglasses, and clothes that cover your skin. Sunscreen. Choose a broad-spectrum sunscreen with a high SPF, 30 or above, and apply liberally and frequently.
Even with good precautions, you might still experience a sun-related rash. Treat these like a bad sunburn. Cool compresses, soothing lotions, and staying out of the sun as much as possible to let your skin heal. Since doxycycline can increase your risk of these rashes even after you finish your medication, continued vigilance about sun protection is wise.
Most doxycycline rashes fade within 1 to 2 weeks after you stop the medication and start treating the symptoms with antihistamines and soothing lotions. However, some factors can affect how long your rash lasts, such as the severity of the reaction or continued sun exposure.
Keep in mind, doxycycline can cause other side effects beyond rashes. Headaches, nausea, stomach upset, and vomiting are relatively common, but there are things you can do to manage them. If these side effects become troublesome, don't hesitate to talk to your doctor.
In rare cases, some people on doxycycline have severe side effects, which should prompt you to stop the medication and immediately seek medical attention. These can include unexplained bleeding or bruising. Doxycycline can sometimes impact your blood, making you bruise easily or experience things like nosebleeds, severe diarrhea with blood or mucus. This could indicate a serious gut issue, dark urine and pale stools, possible signs of liver damage, swelling and inflammation of the mouth or throat. This can make eating difficult and become a serious issue.
If you can't tolerate doxycycline because of allergies or severe side effects, the good news is there are often alternative medications. Your doctor will be able to recommend the best option for you, depending on what condition you're being treated for.
Doxycycline is a valuable antibiotic for many people. Knowing the potential for rashes and other side effects is important so you can proactively protect yourself. Remember, always talk to your doctor about possible medication side effects and never hesitate to reach out if you experience any concerning reactions.